Hi, my name is Sebastian Däröste and I am working in Oslo, Norway, but I am from Sweden. And my schedule consists of 80% is Invisalign, so I am an Invisalign diamond provider, and the rest of the 20% is mainly anterior work with composites, where I use GC a lot. And I do a fair bit of lecturing as well for GC and a few other companies. So today I would like to discuss the ortho-restorative way of working, meaning that with aligners you can first redistribute the spaces and account for the Bolton discrepancy and different gum levels that might be present. And then afterwards you can restore the teeth completely minimally invasively thanks to using materials such as Genial Universal Injectable, which you can then combine either by freehand or with the injection molding technique. There are just so many ways that you can use this. Depending on the case, if it's a larger case, a larger build-up where we have to redo the occlusion, I like to involve the technician to build it up with a larger team involved on the case. If it's, say, 4 to 6 or even 8 anterior teeth, then typically I do it freehand nowadays, but in the start I used a lot of injection molding technique because I felt that was an easier approach to get started with using more and more composite in my everyday workflow. Some tips and tricks would be to definitely to start think more comprehensively and not only look at if there's a little chipping on that tooth, okay, let's put some composite on that and make it pretty again. There might be a reason that fractured to begin with. So start to look at the occlusion and are there any hard contacts that might be in the way when the patient is functioning. Then maybe you should sort that out first. That's why the Align Bleach Bond or Align Bleach Composite or Align Bleach Contour, it has so many names nowadays, but that's why that technique is so good, because you don't have to prepare teeth to do this, but that requires some planning in the start phase. So my biggest tip is get a team around you that will allow you to do minimal invasive treatments, because it not only looks better, it also typically lasts longer and it's easier to pull off for you. And another tip would be that when you do the injection molding technique, really spend some time on getting that Teflon tape right, because if the Teflon tape is a tiny bit wrinkly, that's going to mess up the whole technique for you. So spend some time also when inserting the guide that it's really flush to the tooth. Otherwise you're going to have a lot to clean up that you otherwise wouldn't have had to. What I do with the Teflon tape is one surface, be that if you start on the mesial or the distal, typically start on the surface where you have the hardest contact point, and then hold your fingers on the Teflon tape so you have it in place, and then take a little plier and turn it around. Once you've turned it around, then you can use a thin carver or whatever thin instrument you have and tuck it into the gums neatly, and then it's going to look really flush. But just make sure that you look with a mirror also on the palatal side so it sits firmly there, because it's very quick to be fooled that it looks nice on the buccal surface, but then you miss something on the inside that might have been crumbled up and then distorts your guide slightly. One really easy thing that I've seen a lot of people do, including some technicians where things maybe are going a bit fast, is such a simple thing as when you get the guide back and you're supposed to do these holes that you actually inject the Genial Universal Injectable into, that they punch the holes from the outside in and not from the inside out. And if you do it from the outside in, you're going to get this little extra clear residue on the inside, and this might then end up inside the composite, and then you have all these voids that you then have to drill out, fill it up again, and that just takes a ton of time. And also, of course, when you do punch these holes in the extra clear guide, remember to change the tip so you don't have an extra clear residue left in the tip. So what I do is I use the tip of the Genial Universal Injectable from the inside out, and I don't even have to mount it on top of the composite. I can just use the tip alone, punch the holes where I want them, and then I toss that away and put a new one on before I inject the composite. The reason I use Genial Universal Injectable so much is because it just works both for anteriors and for posteriors. It's strong. It's not like a typical flow that's very runny. You can actually form it to how you want it to. It's also really nice to adapt where you have a need for layering in different colors, because when you blend them, it's going to look even nicer, especially when you do layering, because a lot of people think you can only do layering with packable composite, but you can actually do it with this as well. So it has many purposes. And I use it for attachments, I use it for fixed retainers, I use it in so many areas. As with anything, it's nice to have some hands-on experience before you actually take what you've learned or seen on a YouTube video or heard on a podcast or whatever it might be. Get the feel, get the confidence before you try it on your patients. And that's why we offer so many hands-on courses to give you that confidence.